It's a specific certification that allows us to do clinical lab results. So we can test samples here and determine if someone has COVID and report that result back to a patient. So the lab test that we were running in this space is a saliva-based test, and so it's to compare it to more commonly available testing using nasopharyngeal swabs and nasal swabs. Saliva testing is quite simple. You just spit in the tube. It's painless. It's quick, and it's highly accurate.
A lot of us at Clemson started working on kind of developing new diagnostics tests for COVID starting back in March. And we were really looking to make something that was affordable and we could scale up at large amounts.
As the summer progressed, we realized that having COVID testing, PCR-based testing, was going to be an important component to getting our students back to campus safely. Not the only thing that matters, of course. You've got to have all the other non-pharmaceutical interventions in place, like wearing masks and social distancing.
It costs about 10 times less than your standard COVID-19 diagnostics test. So we're hoping that will allow us to test more people more quickly, both at the university and then eventually, hopefully, in the community as well.
The grand plan is for us to have enough capacity in the lab, and I think we'll get there in maybe a few more weeks to be able to do testing for the entire university at least once a week.
Athletics really has been crucial to the creation of this lab. They helped us validate and prove that the protocols we were doing were accurate and got us the data so that we could actually do this test. They also helped buy the first batch of PCR machines so that we can scale up and do hundreds and almost 1,000 tests a day.
We're going to be able to do less evasive testing more quickly and at a lesser cost. And I think we've all realized over the last 6 months the importance of testing to being able to kind of get back to some type of normalcy. So I think that is a tremendous advantage to having some on-campus testing capability.
It does demand you pay attention and make sure you're doing the right things in order to get the most accurate data and results for people to know whether or not they tested positive or negative for the virus.
Our goal is to ramp to something like 5,000 tests a day, and that means that we would be able to return the results of 5,000 tests in a day. Between when samples come to the lab and when we report, it takes about 4 hours. And that's also because it's on campus, we can quickly get samples to the lab and report out quickly.